Welcome to Ask the Doctor. I'm Dr. David DeRose. We're taking your questions, and we're going to a question posed from Brian in Napa, California. Brian asks, what is gluten and how can it be harmful? What's the difference between gluten intolerance and gluten sensitivity, and how do I know if I'm either? Brian, you are not the only one asking this question. In fact, I've had patients and attendees at my conferences. They say, Dr. DeRose, what's the matter with gluten anyway? Because they've been seeing all the packaging, gluten-free, no gluten. Well, there's actually nothing wrong with gluten. Gluten is a protein constituent of certain grains, specifically barley, rye, and wheat. But some people have an intolerance or a sensitivity or even a frank allergy, maybe even a serious disease process called celiac disease, where gluten actually has become toxic to them. Brian's wondering, how do I know if I've got this problem? Well, first of all, if you don't have any intestinal problems and you're feeling great and you're eating things like wheat, barley, and rye, odds are you have absolutely no problem with gluten. On the other hand, if you have vague abdominal symptoms, unusual skin conditions, there are some skin conditions that can be related to gluten problems. One of them is something called dermatitis herpetiformis. I know that's a mouthful. It simply means you're getting little blisters like a chickenpox type blisters or a herpes type blister. It has nothing to do with a viral infection. It's actually from a gluten problem. So you could have some problems like this, and your doctors may suspect a gluten problem. If so, there are some blood tests that can be done. We can actually test to see if you have antibodies to a protein fragment of gluten. It's called gliadin. So I would order, as a physician, if I had a question, an anti-gliadin antibody. If that's positive, it's at least telling me you've got some immunologic challenge when you're exposed to gluten. It doesn't tell me you've got celiac disease. There's some other markers of intestinal damage that we can measure to see if there's actually problems with your intestine from it. So let's say we measure that like a tissue transglutaminase, and that's also elevated. So we say this is looking like you have a problem, a serious problem with gluten. But if you just have the antibodies to the gliadin and no evidence of problems to the intestine, this is what we usually say, some degree of gluten intolerance. You may find you do better if you don't eat as much gluten or take a day or two a week and have no gluten on that day, just eating things like rice and corn and non-gluten containing grains, or certified gluten-free oats. If people are very sensitive to oats, they're often cross-contaminated with things that contain gluten. But the bottom line is most people can eat wheat, rye, barley, and oats, have no problem at all. These are generally healthy foods. If you've got a problem or a question, you can have specific testing done, see your doctor or other healthcare provider for that. And if you do have a problem, the worst situation, if you've got a serious problem like celiac disease, you have to be totally gluten-free if you want to have optimal health. I'm Dr. David DeRose. The show, Ask the Doctor. To be a part of it, simply send us an email, ask@lifeandhealth.org.